Good afternoon. Thank you so much for joining us and being with us today. We have County Judge Dan Hicks, Dr. Bid Cooper, our local health authority, and Emergency Management Coordinator Perry Westmoreland. We've come together this afternoon to try to answer some questions that are coming into the county and to other places. I just wanted to get some clarification on the coronavirus and the COVID-19. So we're just going to have a panel of questions that are going to be asked that have been coming in, and we just wanted to have some clarification on some things. So I'll start with Dr. Bid Cooper. Based on the situation in Dawson County, a father tested positive for COVID-19, is in the hospital. He is one of the 3 positive tests. His son works in the same office. The son is being told by the health department there that he is under no restrictions other than the general shelter in place. He's been to the store, drive-through, etc., and apparently is getting crucified by people who recognize him. Is that a good policy and/or practice?
If locally in a similar situation, if it's exactly as described in the question, then I would presume that we would have instructed the son to be quarantined as well. You don't know. Based on the question, we haven't heard from the health authority people there what they actually told the son or what he may have understood that they said. So I'm not going to say that they did wrong. Okay. However, in a similar situation here, we would have instructed the son to self-quarantine.
Okay, thank you.
And in this, self-monitor temperature or twice a day and that sort of thing.
Next question is for Judge Dan Hicks. I work at a business included on the essential business list. Should I carry a letter from my employer when I'm driving to and from work or for work?
That's a good question, and that's the first thing that popped up for me that was really surprising whenever we put this order into place was a lot of people calling and asking for a permit or a letter to be able to go to work or to show that they were essential. It's not something that is required in Scurry County. You're not going to be stopped by a police officer, a trooper, or even a deputy and asked to show your letter to show that you're essential. So no, not in Scurry County. You may in other counties. I think that is out there in some other counties, but it's not in place in Scurry County.
Okay, very good. The next question, we'll go back to Dr. Cooper or whoever really wants to answer it. The parks are empty. Are they closed? So this may fall under a couple of you guys. There's just a few of you. Is it safe to eat on the picnic tables?
I'll answer the first part, okay? The parks are not closed. They are open. You can use them. Just use your social distancing.
Whether or not a picnic table is safe to eat on, if you clean it thoroughly, if it was me and I was going to do it, I'd get soap and water or a rag, wipe it off good, dry it off, maybe wipe it off with some Clorox, spray it with Lysol, something along those lines, and I think you're good to go.
Okay.
As long as social distancing, you're going to have to sit at 6 feet apart on the table.
The other thing that we might mention is there's no one out there sanitizing the playground equipment.
Correct.
So you might keep your kids off of the swings and the slides and things like that. Find something else for them to do.
Good to know. Dr. Cooper, the question is, why isn't anyone reporting how many tests are back and how many are pending?
Okay, there on both on the hospital Facebook site and the hospital webpage and on the Scurry County webpage, I understand the total number of tests that have been sent out are listed.
Correct.
And currently in how many positive tests, which fortunately are 0, it does not include those that have returned, which can be corrected easily. And I presume I will ask them to do that tomorrow.
And we'll look at it on our side too.
Yeah. Currently there's a 10th test was sent out yesterday. We've received 7 negatives so far. And so that makes a total of 3 pending, but 1 just went out yesterday.
All right. Next question would be probably for Judge Hicks and for Perry, Westmoreland, about a curfew. Question is, will there be, or are you going to impose a curfew? How will that affect people if you do?
Yeah, right now there is no curfew. It's not something that I would really like to do. I can't say, I will not say never. I will say I will fight against that as hard as I can until it comes time, if we need that. What the impact would be that it would be more trying to enforce what we already have in place in a more strict manner. I do not like the idea of a curfew. I do not want to go there. I hope we don't have to. Any thoughts, Perry?
No, just as long as people are cooperating with the orders that are out there, there should be no need for a curfew.
Okay, with that, I'll just jump on that one real fast.
Okay.
Do you see that people are complying with the order that's out very well? I mean, I've been out and I can give my own opinion, but I don't want to do that. So anyway, just your thoughts. Could people do better?
They could do better. We do understand that not everyone has a babysitter. We do understand that not everyone could do exactly as we would like for them to. But the fewer people that are out, the one basket, one person policy at the stores, that's optimal. That's what lowers the potential for spread to the greatest degree, and that's obviously what we're after. So if people can do everything in their power to comply without taking their kids to the store is obviously better than taking your kids, not just for your safety, but for everyone's safety. If you have 3 times the amount of people, then you have 3 times the potential. That's just simple.
And that goes along with the next question, really. In a nutshell, it says the next question is, should I go to the store alone, or can I bring my family with me? And so that was it. That's either for either of you.
Dr. Cooper might even have something on
Yes,
top of that.
Yeah.
As far as reducing the risk of transmission or spread of the virus, staying home is the best. Social distancing is next best, but a family of 4 people huddled around a shopping cart is not social distancing. And as Perry said, I am sure there are isolated instances where there's just no choice, but that should be an absolute last choice. And if at all possible, the fewer people that are in the store, the better it is.
And to go along with that, we might not be the ones that are sick, or we might be very healthy or feel like we're very healthy, but we all know someone who's not. And we don't want to take the risk of bringing it to that person that is not, or spreading it to that person who's not as healthy as we are.
Next question is for Dr. Cooper. Is it safe to play golf? What about tennis or frisbee?
Okay. Once in a while, yes, it is safe to play golf as long as you practice social distancing, which would include only 1 person per cart. The frisbee, if you're playing frisbee golf where you never are in touch with another person, I think that's fine. If you're throwing a frisbee back and forth to one another, then that is a surface that can potentially hold the coronavirus. It can survive on surfaces. I think there's one question that more specifically deals with that. Tennis I would not recommend tennis for the same reason, because you share the ball. In most circumstances, you're gonna, you catch the ball, put it in your pocket, so no. Solo frisbee and hit your tennis ball against the wall by yourself, and golf at a distance.
The next one again is for you, Dr. Cooper. Are water fountains safe? How about public restrooms?
Okay. The coronavirus can survive on surfaces. There have been various experimental studies where they would contaminate a surface and then test it again in an hour, a day, 2 days, 3 days. And the coronavirus can survive on surfaces to varying lengths of time on various surfaces. The longest is several days, for example, on plastic or stainless steel. But these are experimental situations where artificially they put a virus on it and they come back and test it at periods of time. Currently, there is no documented transmission or infection of a human from a surface with no human-to-human interaction. Can I say that it does not exist? No, I can't say that, but it has not been reported or recorded as of yet.
Next question is either for Judge Hicks or for Perry, either one or both, however you guys want to, I'm not sure. But anyway, how are essential businesses determined and who is making the decision here in Snyder?
That's a good question. It's not just one person. It's not just me, and it's not just Perry. We've gotten with a lot of different areas to see what is considered essential. Now, a lot of that comes from the federal government. A lot of it comes from the state. And if you'll notice that the governor put out a new stay-at-home order, basically, or a new order that lists out essential businesses, which leaves out a lot of the businesses that we have left in. We looked at some of those businesses to see, and it was a group of us, and I've checked with other entities, I've checked with Dr. Cooper and some others to see what we felt like should be in there. So it was basically a group decision, the leaders of the community that have made that decision. What was the second part of that question?
Oh, the second part of the question was, and who is making that decision in Snyder? I think you answered it.
All right, yeah, so it would be the leaders. Yes, sir.
Okay. I sell food or drinks, but don't have any seating. Can I allow people inside?
Okay, that's a good question too. In the original order that governor put out, it said basically close all dining rooms, don't go inside dining rooms. Now, we've kind of interpreted that to feel like any going inside at all to any type of restaurant or any place that serves food or drinks, it would be going against the order. So we feel like you should close the dining room or close your inside to businesses and just do drive-through or curbside service.
This next question is for Dr. Cooper. Can I catch the virus from a food package or at the grocery store?
Okay, much like my previous answer, there are experimental situations where the coronavirus can survive for a period of time on plastic, for example. And there's not been any documented transmission at all. To minimize whatever risk you may perceive from this situation, once again, frequent hand washing is important. It would become, an example, if you wanted to open your package, wash your hands, get your food out, you can do that now. Taken to its logical extreme, that would get pretty tedious. Trying to clean your packages or your cans or whatever, once again, is possible. It'd be very tedious, but just depends on your level of concern. There's no documented transmission from a surface to a human at this point.
Derek, could I hit on that?
Sure.
Maybe we did go to the extreme, but I'm also very susceptible to a bad outcome should I get this. And what my wife and I did, we got online and found the proper mixture of Clorox bleach to water and made about a half a gallon of that. And we wiped down everything we brought home from the grocery store. Now, whether that benefited us or not, we'll never know. But it did not take that long. It was not that difficult to do, very inexpensive to do, and gave us some peace of mind anyway.
And did it have any ill effect on the plastics?
Not that we could see.
Okay.
And there were a few items like bread that we couldn't wipe down. And again, this may be extreme and may even be ridiculous in some people's eyes. We set certain things in the dining room and said for the next 72 hours, we're not going to touch it. Just give it some time to breathe. And if potentially there was something on the surface, potentially it could die. And
You could use a spray bottle.
spray bottle. Yeah, sure.
Okay, let's see. The next question is for Dr. Cooper. If I need to go to see the doctor, but don't necessarily want to risk going to the office, what are my options?
We are requesting that everybody call ahead of time, and the plan will call, so you need to talk to your doctor's nurse's station and speak to the nurse, or if the nurses are busy, then they would call you back and talk with you about what your concern or question is, and decide if it's most appropriate to be seen in the clinic, or could your problem be handled over what we call telemedicine, which is probably the majority of our visits that we're doing now are telemedicine, most commonly FaceTime. You can use Zoom. You can do it over the telephone if you don't have access to a FaceTime or Zoom, for example. And, it's registered as a visit. You can receive you or your insurance company will receive a bill, but that service is available. In the decision, if there's any question as you talk to the nurse, if the nurse is not sure whether you can be managed over the telemedicine visit or you should come in, then she will get with her provider and come up with the proper answer. But telemedicine we're using it a lot now, and it's in this situation has been a real blessing.
And the next question is for Dr. Cooper. Do we have people with symptoms in Scurry County that weren't tested due to the criteria, but could be carrying the virus?
Yes, it is possible. There is no way to know, obviously, because you can't test everybody. We are monitoring the situation closely. The primary thing we're doing to protect ourselves is the stay home, stay safe order from the county. And if you're out, social distancing, frequent hand washing, being careful about how you cough and sneeze, and protecting against that. And that's primarily, it is possible. We don't know. Protect yourself as best you can. We're monitoring the situation and doing the best we can.
And has anyone in Snyder been tested, not for flu or strep, but COVID-19? Are there more tests coming? Are people in Scurry County going to get tested in other counties? I can't wrap my head around 0 cases. Is this the true picture, or is it going to sneak up on us because so few are tested?
Okay, so far we have sent out 9. There'll be a 10th going out tomorrow. 7 have returned, and fortunately there are 0 cases. The fact that nobody has met criteria, or very few people have met criteria, indicates that no one has been seriously ill that had a travel exposure. We're anticipating more testing capabilities. They have not got here yet. Currently, we were sending to the state's very restrictive about the number of testing they can do. And our lab was in Lubbock, and Lubbock is being overwhelmed by their own problems. We were sending to a reference lab out of Dallas. The turnaround time has gotten huge, or at least a week, and we will be sending more tests to another company out of Austin. So right now, today we have very limited testing capability. Hopefully tomorrow we're going to get a significant number of more testing kits that we'll be able to send to the new company in Austin. It will never be where we can do testing upon request. You know, as far as mass population screening is just not in the picture. But we're hoping to have more testing availability in the very near future.
The next question for Judge Hicks or Perry or both says, can I travel outside of Scurry County?
Yes, you can travel outside of Scurry County. Now, you want to be careful about what you're doing. You don't want to, it's the same in Snyder. You don't want to just go to a non-essential business. But if you need to go to the doctor or you have an appointment somewhere, you need to get your vehicle serviced at someplace that you use outside of town, you can make those trips. Now, we would just suggest that you limit those trips. Now, you're still not going to need a travel letter from any of us, as far as I know, going into another county. But we'd say that, yes, you can, but limit it as much as possible.
I don't really have anything to add to that other than we have a lot of people living here that work in other cities and vice versa. We have a lot driving in to work. And we just want them to know that there are no restrictions other than when they're in Scurry County. Obviously, we have the order for what's going on in our county. We just ask cooperation in that.
Okay. Well, just want to thank you all for joining us and being with us this afternoon. That was all of our questions that we had. Hope this has cleared some things up for some people. And I guess if they have any more questions, they contact the county's website or
Absolutely.
Facebook page or the emergency management page. And that way we want people to feel as comfortable as we can during this uncertain time. But thank you all for being here.
You're
Yes.
We do have one common website that all of us are feeding information to each day, and it is probably the most up-to-date, helpful. It has a lot of links on it, and that is scurrycovid.com. Scurrycovid.com.
Scurrycovid.com is the website. Great.
Okay, thank you.
That's it. Thank y'all.
Thank you.